We have almost 50% of machines where we have the data registered, recorded in the machine itself. So manual content in terms of taking data down on a piece of paper is out. And my target is that in the next 3 years, all 100% manufacturing will have everything with the IT-backed machines. I think, as I said, a great place to work. Number 1 in pharma industry and number 13 in overall industry. We have done a lot of work in the area of skill building. The last one I want to share with you, which is very heartening to me, that there are, when we open our, and this is again a lesson that one can take for Make in India, there are places where we find getting good quality labor very difficult. Tarapur is one such place. Tarapur has a history of textile industry, industrial relations strife of in the 70s and 80s, and it's not a great place to live. Although it's very close to Bombay, but what you can talk of Panvel, or you can even talk of Lonavala, or Tarapur is not like that. It's very rural. It's very backward. And we find not only labor, but even the senior management people, they don't stay there for too long, stay for a couple of years, get out. What we did, we picked up some sites where we were finding skilled labor, getting skilled labor difficult. And we have now what we call as Earn While You Learn program. And we are recruiting 12 standard boys and girls from these places. And we registered them with Yeshwantrao Open University for a graduate program, which is funded by the company, and employment is assured to them. This has been a great success over the last 3-4 years. The parents of these youngsters are so happy with the company because hitherto they would go wayward after 12. They don't have a job, they don't know where to go, but this has brought in a new lease of life into those rural areas. And I think, to me, this is a very good experiment that we have done in skill building. These are some of the programs that we run. In fact, the supplement that I'm talking about in today's economic terms, you will see the mention of buddy program, where we have a counselor system. When people join the company, there's a senior person who made a buddy for the 10 new entrants. And he makes he facilitates their stay in the company for the first 1 year, and people now have a separate program also to get trained as being a buddy for the newcomers. This has been received very well. We also have a PhD program going on from three universities in our R&D setup here, because we used to see a lot of attrition of scientists after a few years because they did not have a PhD. We have a master's program running for our technical people with BITS Pilani. We have an MBA running with Narsingh Monji Institute. We also have a program running with SP Jain. So if you see, there's a whole horizon of learning, on the job, off the job, academic, overseas. We also work with ISB. We have been working with IM. I was telling Mr. Devdhar that we have faculty who participate in our programs in IM Ahmedabad. So, 2 parts we finished. We talked about the context. I hope everyone is fresh with the context that we built in the first part. I shared with you how Lupin has been able to shift gear from from being a domestic driven company to an international business company. This $2.2 billion revenue that we have, 72% of this revenue comes out of overseas. About 45% from US, about 14% from Japan, about 7% from other minor geographies. India contribution is 24% today. So this would not be possible if we don't take recourse to a high quality, high scale, low cost manufacturing. So that's an experiment, and I think some of the key drivers, and in my mind, have been the technology, has been execution, which is really process technology, and taking complete recourse to information technology to make things, if I may use the word, flawless. You don't make you don't let the faults linger on. This I shared with you earlier that there are sectors in which we don't have to chase steel. We should of course do more. We should make more steel, not let it go down from 218 million tons to 115 million tons. We should probably make 400 million tons. Country needs it, but there are spaces here which I think our country, biotechnology, chemicals, food processing, media and entertainment, leather, space, textile and garments, IT and BPM, pharmaceuticals, automobile components, where we can really excel, and I think we have the wherewithal. And these are not the sectors where you need some huge amount of labor and land, but you do need. I mean, I'm not saying that it is not required, but it's something that we can really take lead and get going with the program. You know, I was mapping this, and this is something I picked up from a BCG report. Over the years, since 2004, if you see India's cost of manufacturing, interestingly, we have not lost on our cost 2004 till 2014. This is despite all the inflation, all the wage increase, everything. So to me, this is something which is a great strength of our country. Where we lose out, I think Dr. Mashirkar was alluding to this, in cost, we are very good. But when it comes to overall business environment, we are pretty low down at 57. In ease of doing business, we are terrible at 142. This is from the bottom. Logistic performance, we are 54. Again, very low compared to China, Germany, US, Japan, Thailand. Corruption perception, highest. So in some way, costs we are doing well. And that's where my hope comes that, you know, let's get into technology space and build top-class, world-class technologies. You know, I always remember a lesson that I learned many years ago in my management class, VLSI technology. You know, many of us in the room might be familiar with this. Very large-scale integration technology. Japan in the 70s was not having the technology of VLSI. And IBM was working on. Basically, it means putting a 1 megabyte on a chip. You know, that's the technology. And Toshiba, of course, was making notebooks at that time. And they said, if we don't have a VLSI technology, we won't progress in the area of computer. And so what they did, the government, you know, MITI, they took 5 top electronic companies, Hitachi, Fujitsu, NEC, Toshiba, and maybe one more. And they made a joint research institute, which was funded 40% by the government and 60% by these companies. And the program ran between 76 to 79 or 75 to 79, if my memory serves me right. They made about 1,000 patents. Each company made their own patent. They were all put into this pool. Only the 20% of research was done in the joint research institute. The 80% was distributed to these companies. And at the end of the 5 years, Japan had the best VLSI technology. And mind you, even till date, those 1,000 patents are jointly managed by these 5 companies. And the deal is that when they pay back the royalty and the money of the government, then they will split, take away their own patents and do whatever they want to do with them. But the platform is being shared by all these companies. So imagine what a fantastic example of developing technology. I mean, why can't we do it in India? Why can't, in India, we make a cell line which can produce the best biologicals, or the cheapest biologicals, or the safest biologicals, or purest biologicals? I think it's possible, but we need to take recourse to positive thinking in the direction. You know, I think there's nothing new in this slide. You know, everybody knows, you know, what is required. It's published virtually. There is not a day. Today, if you read the Economic Times, the top in the column, the food processing minister, the lady, says that, you know, Inspector Raj is killing the investments in food processing, and, you know, she's blaming FSSAI, which is the, you know, the authority. And this is the minister herself complaining about it. So I don't think one needs to really dwell as to what is ailing. The question is what we should be doing as intelligent thinkers, as people who are committed to the country, people who take pride in being Indians. I cannot overemphasize technology policy, and I just illustrated by sharing with you the VLSI story of Japan, and there are many stories. Of course, in America, because there are a lot of universities and institutions which pour into the technology, they run their own licensing outfits, even in UK, in Imperial College of Technology, in UCL, where they can license out their technologies. America likewise. Japan is something which appeals to me because that was the nation in building. This was the time when it was kind of a laughing stock of the world in the late 60s and early 70s, and became leader of the world in technology towards the end, and how they managed there. And I think for us, a lesson lies there. But what is interesting is that India invests only 0.8%, as against 3.4% by Japan, 2.9% Germany. This is very low. We have to put more investment into research, into R&D. And if micro level R&Ds can do well, why can't a macro level, why can't a public-private partnership work very well in this country? I think we need to think about that. Reams and reams are available on labor reforms. Clearly, there has to be congruence between the state laws and the central laws. There has to be a better retrenchment policy. There has to be a better program for skill building. I mean, one can go on talking on this. But to me, what is important is, what can we contribute at a micro level to this whole exercise? Certainly, a lot of policy corrections are required. There are some good things which, we saw recently. Shram Suvidha is one of those initiatives that the government has taken, which is, gives you a unique identification number to a labor, and you can put all your returns for 4 different organizations on the computer in one go, in one filling. You don't have to do too many filings. But a lot more needs to be done. I think we have a few miles to go as far as labor reforms are concerned. Likewise in land, I think this we hear every day, right from the days, what was that when Ms. Mamta Banerjee raised hue and cry, Sangam, Singur. And I can tell you that we are standing in Pune. Pune itself has so much of issues at times. I had to sacrifice 5 parcels of land before I set up the biotech lab in this place. It's a great place. I mean, it's a crucible of knowledge, academia, thinkers, and therefore couldn't be a better place. One always has a choice of Bangalore, but we being Bombay-based, for us, Pune is very close, and we appreciate and we like the place here. But 5 times I had to abort buying a land because you have to put a notice in the papers 21 days before you sign the deal, and 5 times some Shetkari will put one objection. I lost 1 year, exactly one and a quarter year, and at one time I told my project people, I said, where is the Shetkari's land? They said it's on the boundary. I said, okay, give it to him and take the rest of the parcel. While we were just going to go ahead with that, the penultimate day, there was another Shetkari who put his claim in the center of the land. So we had to again abandon the whole thing. And finally, to avoid all this hassle, we bought a place, which is not adequate by any standard, but peacefully we could take it, was a place sold in auction by a bank. Because the industry closed down and they confiscated the land. And we found that was the cleanest way of taking that. So, I'm not trying to undermine the importance of land reforms, but it's something that we read and learn every day. So there's not much point ponder over it in this kind of forum here. I think any one of us who has ever had the little chance of going to a government office and getting an approval or a permission, I think, can vouchsafe that it is virtually next to impossible. In my business, the DCGI, I even went and met Professor Vijay Raghavan, the biologicals and the chemicals are governed by the same office. And so often, I got a feeling that they were not understanding what the biologicals were needing. And I told Dr. Vijayaraghavan, I said, why don't you please open a separate approval window for biologicals, because it's just getting lost. We put for a very good product, which is I think $1.5 billion product, is called Forteo of Eli Lilly. It's a parathyroid hormone, which is for osteoporosis for women. It's a very, very good product. We put an application for seeking permission to do clinical toxicity in September 11. The permission did not come till 13, and by that time the guidelines got changed. And this was despite dozen reminders. So, when it comes to administrative reforms, I think it's a good story that one has been able to succeed despite all this, but it can be hugely frustrating. So, overall risk score, I think again, we start at the bottom. Legal and regulatory risk, bottom. And tax policy, of course, enough and more has been said already. And we really cannot. I don't know. I think it's something that I feel the current government can really take a stronger view, because they have the majority, they have the right inclination and right desire to do it. Why still hanging, I really don't know, but something that we should do post-haste. The other thing that I see that Make in India would succeed is to create a venture capital environment in this country. I think today, if you read an article of Kumar Mangalam Birla, there's so much tom-tomming about e-commerce because the valuations are so high. But he is sharing the sentiment that I always share, that look, valuation be damned. You have to eventually make profit at the bottom of the line, someday. It's the same story as the biotech companies in the 1980s in the United States. And you could see dime a dozen biotech companies coming up. But they all fell by the wayside, and they were coming with some very exotic concepts of research. And if you look at their market capitalization, huge it was. The hope, the expectation, but eventually they all went bust. Even the .com, we know what happened between 98 and 2001 and 2002. But even today, Flipkart or Myntra or whatever, the valuation is so high, but we are not putting enough into creating an environment for people to take more risk with technology. Venture capital, America, one of the reasons America developed very rapidly because they had a very strong VC culture in that country. So I really believe that access to capital, tax reforms, we've spoken about simplification of business registration process, faster judiciary proceedings, fast-track courts, increased judicial strength, infrastructure enhancement. I'm not saying anything new here. If, it brings me almost to the close of my discussion with you, my talk here, I very strongly believe that there are three things that we should do. One, let's pick a few sectors which we think are most material or will produce maximum employment. We can go by ABC analysis and put a task force on those sectors and make a time-bound accountability that this is what is required, these are the ailments which are happening, and you have to tick a box at the end of a time period, this has been done, like we do in project management in our own industry. Second, I think a huge thing, and Dr. Mashilkar is a person who can really lead the technology push in this country. I think other day Vijay Govind Rajan was writing that 50 years IIM Ahmedabad, they have not produced anything new. IITs, 7 years ago, I spoke to you about asthma. We wanted an inhaler because the Glaxo inhaler is patented in India, and Cipla had some commercial tie-up around its inhaler. So we didn't have an inhaler. So what I did, and I'm very much excited about the development of technology in our country. So I took a professor from IIT Bombay and a professor from UDCT and put them together and sponsored a project to make an inhaler. One was a fluid dynamics expert, the other one was a polymer expert. And they produced a few prototypes, but we wasted about 8-10 months and we were not reaching anywhere. You know, the key here is that when you put the inhaler, then there should be deposition in the lung of the right amount of drug that you need for asthma patients. Not happening. So we have to just abandon the program mid-course. Why? I mean, these are great professors. They teach us so well. You know, we are what we are today is because of them. But somehow that getting over the hump of scaling up, taking a little extra, you know, doing some kind of a crowdsourcing on knowledge is not happening. It's just limited to a table chair research, and that's the end of it. So I think we need to spend a lot of energy, time in getting the technology push, get an ecosystem for entrepreneurship, which really means people should be encouraged. You know, IIT Bombay has a very good system now. You can drop a semester if you have a dissertation problem in BTech. You can drop a semester and try it out if it works for a commercial idea. 6 months you can take. If it works, you can take away. And if it doesn't work, you can come back to the placement cycle again. So I think it's something which works well with us as middle class people, that, you know, I don't have this scare of not getting a job again. So I can get into, I have done a nice dissertation work in my BTech final year. I have a pilot plant which I can take commercial. I get 6 months, 8 months. And professors and the institute is very forthcoming in the direction. And in case I don't make a meaning out of it, I can go back to the placement cycle and get a job for myself. So if these kind of experiments are, you know, multiplied, I think we'll have a culture of experimenting and taking risk, and supported by proper funding. I think we can have a lot of input to improving on technology. And technology space is one thing which can make us leapfrog in manufacturing. That's the way one looks at it. Because, you know, the labor issues, the land issues, you know, may not erase themselves from the surface of manufacturing, but their importance or their weightage in the manufacturing map become that much lesser if you have very strong technology. I just picked up some data on infrastructure. I think again something which most of us are very familiar with. We know how poor, when we talk of 200 kg cement per capita versus 1500, 1600 in China, speaks as to what kind of infrastructure we are creating and what we need in this country. I think we can do a lot more with better planning and coordination across governmental institutions, project monitoring and execution discipline, greater participation from private sector. I think it's happening slowly, but a lot more can happen if that is promoted. I'm very sure that we can get over this problem too. So I know that I rushed toward the end of my talk because I thought it was just getting beyond time. But thank you very much, and if there are any questions, any thoughts, any ideas, I'll be very happy to share and take them on. Oh, it's already 7:15.
Yeah, this is open now. Please state your name and affiliation, and then.
Thank you. Yes, sir.
Vivek Karyakarte, Managing Director, Esting Power Equipments India Private Limited.
Yes,
I have heard a lot about Make in India and all, but how to approach is the biggest problem in front of me. I just see everything in newspaper that there are so many global talks are going on about it. But actually, I mean, plug and a socket. How to arrive at that stage? I went to various sites of government, but nowhere it is written. So I would like to know how I can go about it. If my company is interested in doing something Make in India with overseas collaborations or whatever government is launching new schemes and all, exactly where we have to look for a strategic partner, that forum, that website, I do not know really. I mean, I do not know whether this is the correct forum to ask the question, but since you have gone through a lot of things, I would like to know about it.
Yeah, I want to do, you know, as I said, I am working with a pharmaceutical company, so I'm looking at the pharmaceutical space, what all I should do, what is the future trend in that business. 60% of world's population is aging. So what are the ailments of the older people? They cannot swallow. So if you give them a tablet, they cannot take it. So do I need to convert tablet into a liquid? Or do I need to put a patch on their skin which can take the drug to the skin? Or they will have loss of memory as they get older, dementia. So do I work in the area of dementia, Alzheimer? Unfortunately, the cancer is growing at 19 to 20% world over. So do I enter oncology? Obviously, I can't enter all. Then I do a risk-reward matrix analysis and say, this requires so much investment, this is the kind of risk that